Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about innovations in dentistry, oral care, and painless dentistry is Dr. Alisa Kauffman. Dr. Kauffman and the dentist at Geriatric Dentistry have been providing award-winning dental services to the elderly population for over 35 years. The practice is one of a few select options for geriatric senior citizens who need dental work but cannot leave their homes. Dr. Kauffman has been nationally recognized as a top 20 dentist in the United States and is consistently featured in the New York Times, ABC, the Chicago Tribune, and the Penn Gazette, to name a few. How are you doing today, Dr. Kauffman?
I am doing really well. I just got my second vaccine, so I'm a little bit disorganized.
Oh, that's good.
Less organized than usual, I should say.
Congratulations on getting that. That's wonderful. So before we get started, for those that are joining us for the live webinar, if you have any questions, time permitting, we'll do everything we can to get the questions answered. Go ahead and type those questions in. Dr. Kauffman, let's get started. Your house call model is probably considered innovative. Has the word spread that this service even exists?
I hope so. I don't even know whether all dentists even know that it's possible. I do get a lot of calls from all over the country where people ask me, do you know a dentist that does what you do in Cincinnati, or just to name a few, LA? And sometimes I know someone, but most of the time I have no recommendations, unfortunately. So I would love to see this become a national project and organization.
Yeah. So I have a two-part question, Dr. Kauffman. One is, how do you discover new products or innovations in dentistry, and how often does this happen?
Good question. Most dentists go to a dental convention once a year, and I always look forward to the one in New York at the Javits Center. This year they didn't have it, obviously, because of COVID, but in 2019, I was introduced to some really great products that I really believe in. I'm always looking for toothpaste and toothbrushes, things to help my dementia patients, and just people who are aging in general. So I like to find really great products that will make my life easier when I go to people's homes, and also to promote them because I really believe in them. I never promote anything unless I use it myself or would use it on my own family.
Yeah. So once you find these innovations, Dr. Kauffman, how do you determine which ones you're going to go into immediate use into your practice?
First, I bring home the samples and I try them out on myself. I want to know whether they're like for toothpaste, for example, I want to know if it's tangy. My patients don't like anything that has a very, very strong taste. And I look for things that don't have sulfates or a lot of additives. Sulfates are the ingredient in your shampoo and your toothpaste that make your mouth or your hair feel foamy and clean. Well, that's not necessarily what my population of people really want, and I don't think anybody needs sulfates in their toothpaste. So I would never use that myself. So I looked for products that that don't foam up, but do a good job and are not very irritating to the gums and are more calming. So I look for things that kill good bacteria, that kill bad bacteria, but leave the good bacteria that's necessary in your mouth for digestion and moisturization and things like that.
Yeah. So what types of toothpaste, or what type of toothpaste do you recommend?
The only toothpaste that I'm recommending now to all of my patients is the closest silver line. It looks like this. I don't know,
Yep, can now.
Okay, so they make two lines, the sensitive line and the silver line. And silver line is for over 55, which obviously I am. There is a toothpaste and a mouth rinse. And the way I like to tell my patients how to use this is you're going to brush with the toothpaste, and then you are going to, instead of rinsing their mouths out with water, you're going to rinse with the mouth rinse. And that's a great combination. So you're used to using water afterwards, swish and spit. You want to use the mouth rinse directly to swish and spit. It's very mild, it's very calming. It has fluoride, and the formulation is really meant for older adults, 55 plus, but really anyone could use it. It reduces the plaque, it strengthens the enamel to make your teeth stronger, and it leaves the good bacteria and kills the bad bacteria. They have an ingredient, chloralstan, that's patented, ADA seal of acceptance, which really keeps your mouth healthy. And that's one of the things and the differences between that and other brands, which I really, really like.
Yeah.
Yeah.
I want to move on to toothbrushes. I keep hearing about smart toothbrushes. Can you talk a little bit about that?
I can. I'm going to talk about 2 toothbrushes today. This is a new toothbrush on the market. It's a little bit pricey. It's $7.99. I should have opened it before the show. I'm going to open this one, and I'm going to use it myself. This is made by Dr. B, Dr. Burland, Dr. B Solutions. And why is it great? Because a lot of older adults have a problem with dexterity, so you can really hold on to this handle. And the bristles are extremely soft, and they really, really get under the gum line. And if it looks like it could be used on a denture, well, you're right, it can. What makes this unique is this toothbrush can be used on your own teeth, and it can also be used with your denture to clean your denture. You can clean your tissues in your mouth with it, your gums, your dentures, and then you keep it clean. You rinse it under the water. You could put it in the dishwasher. I don't think people realize that you could put your toothbrushes in the dishwasher once a week, which I do. This is the Willow device, the robot. This is the toothpaste and the water to help you rinse. And this little tube here goes into the sink. You put the mouthpiece. There's an on and off button, and that's all you have to worry about. So I'm going to do the bottom first. There's nothing to spit out. It rinses your mouth with this little, and then all the water comes out of this little tube. So that's it. It's very, very, very simple and very effective. Love it.
And so it is a predetermined time then, right? As far as how long it works on the lower and the upper level?
Right, and then you just flip it for the upper, but it brushes all your teeth. You feel it brushing. You feel the soft silicone mouthpiece goes in, all those bristles move around, and then you feel the nice stream of water. You can make the water warm, and then it flushes all of the toothpaste that's very mild right out into the sink, and you don't have to spit. There's nothing in my mouth right now. It's for people who bite, who can't participate in brushing themselves. Okay. So it's really a great product, and it's coming out on the market the beginning of next year. And WILLO, so willow.com for more information. They already have their website set up, and there's some great graphics on there and information about the product. But it's really a fabulous product. It's really great for kids too, kids that have disabilities.
So is there a special way to brush and floss that maybe is what we grew up thinking was a certain way you should do it?
I would say that people brush their teeth incorrectly. You want to always make sure that you get under the gum line. And when you aim the brush, you should aim the brush in little circles under the gum line, and then back and forth, front and back. And 10 seconds is certainly not enough to brush your teeth. You want to brush your teeth for a good 1 minute on the top and 1 minute on the bottom. And that's why Willow's so great, because it times it for you. So you're not, it doesn't stop until, it doesn't turn off until the minute is over, which is great.
Can we move forward and talk about mouth rinses? Are they necessary?
I believe they are. They really are a great adjunct to brushing. And, you know, the way I told you to use the closest is you use it after you toothbrush, and then you use this as a rinse instead of using water. So it's a very palliative and cleansing and moisturizing way to keep your mouth clean and to kill the bad bacteria and to keep the good bacteria. So yes.
Oh, isn't there a product out there that stops decay in its tracks?
There is a product that stops decay in its tracks, and it's called silver diamide fluoride, and it is known by the brand name Arrest. There's different companies that make it, but the Elevate makes the brand name Arrest, which I really like. And it's really great for people who cannot do a lot of dental work, but if you find decay in the mouth, you use the Arrest and the decay is hardened. And then you don't have to worry about the tooth becoming symptomatic and then needing a root canal. So it's not for everyone, obviously, if you can get to the dentist and you can get your teeth filled, but it's used to stop decay. So it's really good for little kids who are scared of the dentist and for dementia patients where you really can't do a lot of dental work on them, but you want to stop the decay.
Yeah. Can you explain what a denture is, Dr. Kauffman?
A denture is a replacement for missing teeth. A full denture is when you have no teeth. It's a complete denture or a full denture, and it's made of acrylic, which is a specialized type of plastic, and it fits on top of your bone and your gums. And a partial denture is one where you have a few teeth, and then the denture is hooked onto the teeth that are left. And there's many types of partial dentures.
And so for a company like yours that works with geriatric house call dentistry, how common are dentures?
They're very common. Unfortunately, we can't do implants at home, and not implants for everyone. You know, some people just don't want to go through with the surgery, or they're not able to because they're on blood thinners. But the partial dentures are a substitute for having no teeth. So you get your dignity back, you can smile again, and you can chew your food more effectively. And, you know, it's something that's very necessary, I think, you know, to be able to smile, to be able to socialize, and at the same time, you want to be able to chew effectively, which is why you need your teeth in the first place.
Right. So what new products are there in the denture arena?
Well, this toothbrush that I showed you is definitely something that's very unique because it's for your denture and for your teeth. So it's good for complete dentures or partial dentures. And I also like the same line, Dr. Berland's. This is called Adhesident. I want to make sure I'm showing you the correct one, Adhesident. And why is this great? Because it doesn't dry out your mouth, and all of the ingredients in it you can actually pronounce. It's not big pharma, it's small pharma, and it has very innovative products that make it very long lasting and very, very great holding abilities, and it relieves your dry mouth, so it doesn't dry out your mouth. It has vitamins A, D, E, and aloe vera. There's no colors, there's no taste, which is great because you don't want to taste anything. Some of the other adhesives have mint taste, so why would you want mint with your oatmeal? And it has the ADA seal of acceptance, which is really important. All the products, the Closest line does as well. By the way, Closest you can get from CVS and Walgreens. And Dr. B, you have to get online, I think Amazon, or you can go straight to his website, drbsolutions.com.
So once again, a lot of these new features that are coming out, new products that are coming out, they can either get them through you as far as their dentist, or they can just go to, you know, CVS or whatever.
Correct. Every one of my patients gets Closest toothpaste. Okay. And I give it to the aides as well because they all want to try it, and it's really great. I really recommend the Closest to everyone. And then the Cleansadent is I mainly give this, I don't give this to people with teeth, but I give this to my denture patients whenever they get a new denture. I know the lighting is off, right? Can you see that? The
Yes, a little
cleanse
bit.
dent you could use, it's the only toothpaste that you could use on your own teeth and on the denture, or your partial. So you could use it on tissues, and you could use it on teeth, and you could use it on your gums, and it's the only one that that I know of that you could use for both. Usually you can't use regular toothpaste on your denture. It's not meant for that. It's too strong. But this one is very, very mild. Probably you could use the closest as well. I mean, they don't say that in the product line, in their description, but it's very low abrasivity, which means that it won't scratch your teeth. Toothpaste can be very abrasive, so probably you could use that one as well. But for all my denture patients, I give them the Alisa Dent. They make other products too, like moisturizing cloths that you can clean your dentures out. Like say you're at a restaurant, you want to go in the ladies' room or the men's room, and they make Cleanse-A-Dent crystals, which I give to every patient, which is the soaking agent to make sure that your denture doesn't harbor bacteria that could cause pneumonia or candida or even MRSA. So you can get all those infections from not keeping your denture clean. And some people sleep in their denture. You should never sleep in your denture for that reason. You want to keep it clean. And the only way to get it clean is to take it out and to soak it overnight. The other thing is, if you wear your denture all the time, you will wear out your bone, and then your dentures become loose. So you're not doing yourself any favor by sleeping in your denture.
Yeah. So, Dr. Kauffman, you've been doing this for 35 plus years, and you've seen a lot of technology come into the dentistry world. What are you most excited about as you look forward?
I am really looking forward to the day when we don't have to take impressions anymore, which has already arrived. Unfortunately, it's hard for me to learn new tricks with technology, but you can take impressions now within, using technology. You don't even need to use the old tray method where you're taking an impression and putting in, alginate or impression material. And that's what they're teaching in dental school now, and that's what is going to be coming up. No one is going to have to deal with impressions anymore. So that's very exciting. And the technology of I have a portable x-ray that's 3 pounds that you never really need to go and put an x-ray unit in your wall anymore. And you get crystal clear images sent right by Bluetooth on your phone. So that's amazing. I have that. But there's a lot of new products and a lot of new innovations coming out. And I think that one of the most important things that will happen in the future is I think that they could probably solve the whole issue of dental decay. It's a bacteria why can't they put something in our water besides fluoride? Maybe not fluoride, and I'm not so sure about fluoride anymore. I do a lot of reading about fluoride, but there should be something to take never have to worry about decay ever again, or periodontal disease ever again. So I'm sure that's happening. I mean, if they could solve COVID, right? Dental decay would be very
Right. So when you talk about the services that your dentistry offices offers for seniors, you said the portable x-ray. So what other things are you kind of looking forward to as you kind of go forward?
I'm looking forward to more people joining my network so that this service is everywhere. That would be my dream, that this was a national service, maybe that Medicare would even offer some payment towards it, and Medicaid would pay a little bit more, because you can't really afford to do this kind of treatment with Medicaid fees. I think that this is a service that everyone should be privy to, not just people in big cities like New York City and Chicago. This should be a national service, and they should teach it in dental school. People should be more aware that you can do this type of work at home.
Yeah. So in the title, we got the title, it says oral health and painless dentistry. What does the term painless dentistry mean?
Painless dentistry just means that you're able to make the person comfortable before you have to do a procedure that may cause pain. So we like to use a lot of topical anesthetic or even just regular anesthetic. I don't feel like I ever really cause pain with any of my treatment, with the exception sometimes you take an impression and the corners of the mouth, are stretched. So some people complain about that, but that's the most pain that I see in my dental practice. There really should not be any dental pain in 2021 with the great anesthetics that we have.
What do you see as a common problem with a lot of our older or aging population?
One of the problems that I think is very prevalent is people feel pain in a tooth and it's very painful for 2 days and then it goes away. And they think, oh, well, I guess I'm all better now. And then I'll get a call a week later that their face is really swollen. And then it becomes like a huge problem. Whereas maybe that wouldn't have happened if they would have called me sooner and I could have taken an x-ray and made a diagnosis and a treatment so that it didn't get to that painful stage.
Yeah. Now, for those with cognitive impairments, we had talked about advanced Parkinson's and the ALS or dementia. Are there some technologies coming down the pike outside of the toothbrush that would make your job a little bit easier if that's possible?
I don't think so. I wish that was something that I could look forward to, but you just have to really be a patient person and get them to cooperate and to make them feel comfortable. And that's why doing it in the home is so great, because they're in their own environment with their own people and their own surroundings. And I do a lot of fibbing. I tell them that I'm their daughter's dentist or daughter's friend, and it makes them feel more comfortable, and I gain the confidence that they have that I'm there to help them, because it's scary, especially for someone with dementia, to go to an office with new people, or they know it's a medical environment, the white coat syndrome, and they don't have that at home. So it's a more friendly environment, and I get them to cooperate. I do whatever I have to do.
Yeah. Got a question that has come in. It says, for house call dentistry, what services are not offered?
Great question. You can never do a root canal at home. You should only go to a root canal specialist who uses a microscope, and that's something that's very important. I would never trust a regular dentist to do a root canal, because you really need to see inside of the root canals, which are microscopic, which is why you need a microscope. So that's one thing. I don't do any crown and bridge. I'll re-cement a crown, but I don't do a new crown or a bridge, and you can't do implants. But you could do everything else. You could do extractions, you could do fillings, you can do dentures, denture repairs, emergencies.
Yeah. Another question. So I'm going through cancer treatment right now. What do I need to inform you as my dentist about if we're looking at possible having fillings or something along those lines?
Well, closest products, the mouth rinse is really great for cancer patients, because there's a lot of xerostomia, which is dry mouth, involved when you're on cancer drugs. And I don't know if you're getting radiation. If you are getting radiation, you really need to talk about that, because you should be getting fluoride trays if anything is in this area, because the radiation can dry out your mouth. So that's very, very something that you really need to talk about with your physician and your dentist. And, I think you should always inform your dentist if you're going through chemotherapy or radiation therapy. And then they could at least recommend products, because some of the side effects that you didn't realize could be handled, dry mouth, canker sores, ulcers, some of those are side effects, and we can help you.
Yeah.
Hope that answers the question.
Yeah. Another question has come in, and they ask, how often should I be seeing my dentist as I age? Should I be seeing you more often?
Well, that really depends, and it's funny, there are some older people, even 90 years old, their mouths are so good, and there's really, I check every 6 months, and basically every 6 months is what the minimum is. If you have periodontal issues, which means your gums bleed, or you're prone to cavities, or you have silver diamide fillings in your mouth, not really fillings, sealants in your mouth that should be done once or twice a week. Oh my God, my brain is fried. Once or twice a year, you want to see your dentist and make sure that you're managing that so that it's very, very reliable if you keep up with the program. So 3 months is pretty much the most I will see someone, but usually every 6 months. Listen, it depends. You know, if you have a lot of dental treatment and you want to get it done, you might see your dentist every week. You might like your dentist. You want to see her every week. But if you have any specific questions that we haven't answered, you can go on my website, fill out the form, write down your question, and I promise you I will answer you.
Okay, very good. Well, Dr. Kauffman, how can people find you?
Well, the email, I don't look at my emails all the time, but if you go on my website and fill out a form, which is Geriatric House Call Dentistry, Geriatric is Geriatric. House call is just the way it sounds, house, HOUSCALL, dentistry.com. And just write your question out and I will answer it.
And what locations are you guys in now?
So now we're in Manhattan, we're in Queens, we're in the Hamptons and Long Island, Chicago, and Nassau County, and growing, and also in Lapine, Oregon, and in, Lapine, Oregon, right?
You are growing. As far as knowledgeable aging, you can find our webinars on our YouTube page. If you want to go ahead and please subscribe, we update the YouTube page 4 to 5 times a week. You also find our podcast on Spotify and iTunes. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.